On May 17, 2026, the World Health Organization declared the ongoing Ebola virus disease outbreak affecting the Democratic Republic of Congo and Uganda a public health emergency of international concern under the International Health Regulations 2005. The declaration of a public health emergency of international concern underscores the need for heightened international and regional vigilance and coordination, especially given the current situation in conflict-affected regions with limited access to healthcare services. Although at present, this event is not classified as a pandemic, coordinated international action is required. The current Ebola outbreak is concentrated in the Eastern Democratic Republic of Congo, Ituri, Nord-Kivu, and Sud-Kivu provinces, and Uganda, particularly Kampala. The cause is the Bundibugyo Ebola virus strain, which is relatively rare, for which there are no licensed vaccines or specific therapeutics. As of May 27, 2026, there were 1,018 total cases, including 1,011 in the Democratic Republic of Congo and 7 in Uganda, and 234 deaths, 233 in the Democratic Republic of Congo and 1 in Uganda, with a case fatality rate of approximately 23%. There are no cases of the Ebola virus disease in the Caribbean region. The current risk of this disease in the Caribbean is assessed by CARPHA as low. However, given that the introduction of the disease to the Caribbean region can happen through travel associated with importation and the region's high connectivity through international travel, it is important that the national surveillance system is strengthened. Ebola virus disease is a severe and often fatal disease caused by viruses in the genus Ebola virus. The current public health emergency of international concern is as a result of an outbreak caused by the Bundibugyo strain. Historically, the case fatality rates range from 30 to 50%, and the incubation period is between 2 to 21 days. The common symptoms of the Ebola virus include fever, severe headache, muscle pain and weakness, fatigue, sore throat, vomiting and diarrhea, abdominal pain, and unexplained bleeding and bruising. Severe illness may progress to multi-organ failure, shock, and death. Ebola virus is transmitted through direct contact with the blood, secretions, organs, or other bodily fluids of infected persons. It is also transmitted through contact with surfaces and materials contaminated with these fluids and wildlife. Persons infected with Ebola become infectious as they develop the symptoms. The Ministry of Health, Wellness and Nutrition is closely monitoring the outbreak and preparing plans for prevention, early detection and management in country in consultation with the regional public health agencies. Surveillance is being strengthened at the level of the ports and travel history screening. Health systems are being strengthened through the development of national preparedness plans for viral hemorrhagic fevers, healthcare worker sensitization, reinforcing infection prevention and control measures, review of personal protective equipment, and ensuring clear protocols for safe patient management. Testing capacity for Ebola virus disease is not available in the Caribbean region. The Ministry of Health is also working with the regional public health agencies to coordinate sample collection and transfer to CDC Atlanta if the need arises. During the coming week, the Ministry of Health is scheduling extensive stakeholder presentations and discussions with health, tourism, education, and the business sector to strengthen coordination and collaboration in matters relating to Ebola virus disease. The Health Education and Communication Unit is developing the risk communication plan to facilitate the delivery of targeted evidence-based messages to the public to support early recognition and adherence to country guidelines for care and management. The Ministry of Health will continue to monitor the global development of the outbreak and provide regular reports and updates.